Our next guest actually joins us all the way from Paris, France, to present his talk on understanding opinion in the post-truth age. From the French capital, the CEO of Ipsos, Ben Page.
Good morning, everybody, and I hope, or good afternoon even, perhaps, in Turkey. I'm going to share my screen. It says it's disabled screen sharing, so hopefully they can fix that, because if they don't, it will just be me without some slides. But so I wish I could be there in person. The disease makes that a bit more difficult, but let's see if they'll let me share my screen. They will, which is great. Okay. There we go. So if you would like these slides, do message me, and I can send them to you, ben.page@ipsos.com. Ipsos is one of the world's largest research organizations, and I wanted to look at the challenges we face in understanding the public in the post-truth age, in an age where, as the head of the United Nations the World Health Organization puts it, we're not just fighting a pandemic, we are fighting an infodemic. And many people around the world have got a very strange idea about reality in the current situation that we're in. And I think it's a brilliant example of the challenges communicators face. And in this instance, of course, it means people die. In many countries, around 1 in 10 people actually believe that the coronavirus pandemic is a scam. It's made up by the authorities to control people, to force vaccinations on the world. And that's just one example of fake news, in a sense, that is sweeping the world. And it's able to sweep the world much more rapidly than ever before because of all the technology that we have. It's not new to be wrong about things, but it's a reminder of the challenges we face as communicators. And the interesting thing about this is that very clever people are not necessarily more accurate than the public themselves. This is John Maynard Keynes, a famous British economist who predicted that by 2030, we would be working only in 3-hour shifts or a 15-hour week. This man at the Beatles predicted that the Decca Records, it's early here, Decca Records predicted that the Beatles have no future in show business, he said in 1962, before they became one of the best-selling groups of all time. We don't like your boys' sound, and 4-piece groups with guitars particularly are finished. So completely wrong. This gentleman, I'm afraid they're all men, this gentleman predicted that everything that can be invented has been invented. And that was back in 1899. And he was in charge of patents in America. And one of the greatest British scientists said that X-rays will prove to be a complete hoax. They don't exist. So we can show you the public being wrong, and we can show you experts being wrong. Here's a classic example for public communicators or politicians. This is in Italy, where they're having an election. And what are the issues in that election? They're about immigration, the state of the country, the challenges facing the country. The Italians believe that 3 out of 10 people in their country are immigrants. The actual figure was 9%. They believed, when we asked them, that half the population was unemployed. Now, there is a lot of unemployment in Italy compared to some European countries, but it's only 11%. And Italy is one of the oldest countries in Europe, and Europe soon will be one of the oldest countries on earth. And you do see a lot of older Italians sitting around, but the percentage of the idea that half the population is over 65 and retired, when actually it's 22%, just shows that on many issues, you'll find that the public have really dramatically inaccurate ideas. And I think particularly with the challenges that we face on the pandemic, but indeed in terms of how governments are to lead divided peoples, means that we really need to understand what's going on here. And the first point, I think, is that opinion polls, despite their challenges, remain the best way of understanding public opinion overall. It's a little bit like democracy. I think, what did Winston Churchill say about democracy? You may have gathered that although I'm in Paris, I may be British. And Winston Churchill said, democracy is the worst system of all, except for all the others. And in this case, just to give you an example of how opinion polls, despite their challenges, can be highly accurate. This is 2 days before the UK general election in 2019, and you can see the average error for each party in the polls is less than 1%. Ipsos, 0.3%. I've got to make a claim there, but not bad. And in fact, despite what you may read about opinion polls and their accuracy, if you look at Professor Will Jennings' analysis of all general elections in all countries from 1942 onwards, what he found was that opinion polls weren't getting any worse. They weren't getting any better either, which is pretty interesting, given that the internet and even telephone polling did not exist when this time series began. But overall, polls have averaged about plus or minus 2% for each party on average across the world for decades. So opinion polling done well is still going to give us a pretty accurate idea, although it's not perfect. And when 2% matters, then you may be in a challenging situation. But overall, opinion polling is accurate to about plus or minus 2%. So why are we wrong so often? I think the first thing is we are, all of us, and this is something that's been a big lesson in my world, we are all personally biased, and including communicators, and we should remember that. So when we ask people what we need to do to fight climate change, you can see 6 out of 10 people around the world say the most important thing they can do is recycle. And they think that will do most to reduce carbon emissions. That's actually only number 7. And most people don't like to confront the fact that having fewer children, flying less, and not giving up a car is actually likely to have far more impact. We're also likely to be biased towards, in terms of the future, towards optimism. So nearly half of Chinese citizens think that they might win the World Cup in Qatar in the summer, in the Football World Cup. And I can tell you now, if anybody wishes to come and make bets with me, the Chinese are not going to win the World Cup in Qatar. That will not happen. But of course, they want to believe that they might. It's the same with human beings, where we believe that as we grow up, we'll have a wonderful life and marry the perfect person. Divorce rates suggest that this is not going to happen always. The other thing is that, and I think this is very important, we overestimate things we're worried about. So this chart shows you the number of people having teenage girls having babies when they're aged 15 to 19. And then the actual numbers are here. So in my country, in the UK, it's 1. In Argentina, it's 6 out of 100. The average is about 2 in 100 people globally in the countries we looked at. And people's guesses, their estimates of how many people in the classrooms, in their schools, in their colleges of further education, is that many more girls will be having babies. In Argentina, they think nearly 4 out of 10 girls, 37%, will be having a baby before they're 19. In America, at 24%. In Britain, for example, 19%. And so the estimates are massively wrong. And I think the key thing that research can let us do, qualitative research, whether you're doing it online or face-to-face, is to understand why that is. And the main reason, of course, as good communicators that you all know, the main reason is how emotional stories affect us. And so we read about the 12-year-old girl having a baby. We read about dramatic fraud by people, perhaps in welfare systems. In my own country, again, the public believes that £1 in every 4 that is spent on pensions, on welfare, is being fraudulently claimed. 1 in 4 of that pound, a quarter of all government spending is being fraudulently claimed. But that is actually because newspapers and sometimes politicians have chosen to focus public attention on individual cases that are very dramatic, that affect us. We don't like to believe that millions of people are stealing money from the government. And so, but those vivid stories appeal to us. They confirm something that we believe is true. And so we believe that and not the actual data. We also, all as human beings, have a tendency to focus on negative information. And of course, so do the media. They need to sell newspapers. They need to get those clicks. And so we all have those biases about the present. Interestingly, our biases about the past are far more positive. So if you think of your last holiday, perhaps before coronavirus, and before you went on holiday, there was a lot of excitement. We were going to go somewhere great. When we got there, perhaps it wasn't quite so good. The hotel wasn't as good as we'd hoped. The food wasn't quite perfect. When we got back, it was raining again. But the interesting thing about our holidays, and think now about your youthful holidays, those summers of your teenage years, or when you went away with your parents, over time, you gradually edit out the bad bits of the past. And the past seems a wonderful, happy place. And instead, much better than the present. So we have all of these biases, and a key challenge for communicators is to understand those. There's no sign at all that our biases are worse than the past. But the evidence is that the online environment threatens our view of reality at scale. And it's very clear when we look at people who believe that the coronavirus pandemic is a scam designed by Bill Gates to force microchips into people's arms, for example, is highly concentrated among people who make heavy use of social media like YouTube, or particularly WhatsApp or Telegram. They're in private circuits. They don't engage with mainstream media, and they're able to build their echo chambers and find other people who support their views. And unless public strategic communicators can engage in a meaningful way, and telling people they are wrong does not work. I know this to my cost. A close friend who's actually also he was a Jehovah's Witness, but he didn't believe in the pandemic. And I kept trying to say, look, I work in a data organization. You've got to have the vaccine. He's just, look, I've seen this stuff online. I don't believe it. I'm afraid I'm going to have to disagree with you, Ben. Well, he's dead. He died on the 15th of September, having refused to get the vaccine for months and months and months. And that's because of that online environment. So I think the key thing finally is to focus our communication on what drives perception of the issue you're focusing on. So really make sure that your research lets you understand how people are making decisions about the issues that you are trying to communicate about. I will give you one example because it's good to be brief, but really understand those issues, because once you do, you can be disciplined, you can focus on the messages that will cut through, you can stop wasting time defending yourself on the issues that don't matter, and you can sometimes stop worrying about certain things. So this is an example from hundreds of studies in the UK where we've looked at a key national issue in the UK for any government communicator, which is what makes people happy with the health service, the British Health Service in the UK, the National Health Service. And the key finding here is that the thing that has the biggest impact is not how well the health service is doing operations on people's knees, treating cataracts, you name it. It's actually whether you like the government. If you like the people who are in charge, you will feel more positive. If you're old, you will be much more positive than if you're young. And those things actually have more difference than anything that is happening in a hospital. There is part of the service that drives perception, which is the emergency room, accident and emergency. Very important to get that right, because that's where the majority of people will have experience of it. And then a key point for communicators, because doctors and nurses in Turkey and in the UK and all over the world are some of the most trusted people on the planet, one of the challenges for anybody running a large health service is to make sure that the staff are not out there telling the public that it's terrible, because they will be far more believed than any professional communicator or any politician. And in the UK example, in the past, the pay of health service staff and their pensions were doubled. The expenditure on that was doubled. And yet, because of the way communications were handled with those people, actually those who met doctors and nurses felt worse. Then, of course, we have media and social media coverage. You've just heard from my colleague earlier about how we need to get that right. Then you have the service's own communications directly. So it does still matter, but it's much weaker than verbal communication. And only after any of that do we have what actually happens in a hospital, all the things where we spend nearly all the money and all of our time. So if you're interested in perception, it's not necessarily going to be exactly about the service itself. It may be about a number of other factors. So we really need to be clear from our research what is going to actually affect perception. I think the challenge is that looking at past data really only gets us so far. There is a lot of empirical evidence, a little of that I've shown you this morning that we can use, but overall it will only get us so far. And if I was to leave you with nothing else, I would say really examine as a communicator, but also as a researcher, your own bias. There's a very important role for having lots of different data points, not just one type of survey, not just social media data. Anybody who thinks Twitter represents the world needs to go back to bed and have a long sleep, because it doesn't. But it's still very important. Use intelligent analysis, but also you need a range of analysts, because we're all biased to what we want to happen, what our life experience and our memory suggest will happen. And indeed, in my own career, when I have been most wrong in my predictions, often it's because I'm allowing, when I look back at what happened, I'm allowing my own biases to mean that I have selected, and I'm a guy who's entirely based on data, but I have used my own biases to select pieces of data that confirm what I want to happen. So we need to look at the bias in the data itself, but the evidence is that if we can get the best data sets that we can find, if we can find that data, and then try and remove our personal bias, sometimes by making sure that you've got a group of people looking at it who are not all from the same political viewpoint, or not. You may actually, I might want to, if I was really going to communicate about the coronavirus, I might actually want to employ an anti-vaxxer on my team, along with all the health specialists and scientists, to help in the communications. I've got practical examples of where that has made a difference in making better decisions. Those of you who have read Philip Tetlock's books on forecasting will know that the most accurate forecasters do not live in Ankara, Istanbul, Paris, London, Rome, New York, Washington, DC, or San Francisco. They are often retired professionals who don't care what happens. They really don't care about your problem anymore. And they are able, therefore, dispassionately to examine the evidence without bias, one way or the other. And from that evidence, their forecasts are often better than those of professional analysts who care passionately about the issue. So really choosing a diversity of approach, but also a diversity of analysts really matters. And we also need to get better at living with uncertainty. COVID-19 is a brilliant example. We knew that the pandemic was likely to happen, but somehow we managed to forget it. This is actually a forecast that Ipsos did 13 years ago as part of work for the UK government. And we said the emergence of a new and lethal virus strain that is highly adaptive, capable of human-to-human transmission, resistant to known vaccines and treatments, could swiftly result in a global pandemic. Nearly all predictions of the future did that, but we didn't pay enough attention to them. And so we need to be really ready for those unforeseen events. And I think that is what will help give us resilience. So in terms of what we have learned about prediction from the 2 years of the pandemic and the infodemic that we have seen, this is what I would finally say. I think the first thing is we cannot leave information vacuums where people get educated through one-side perspectives. I mean, it can be okay in political communications if you have decided that one group of people will never support you. But in terms of public communications, where we have a duty to communicate to a whole population, you just cannot assume that people are rational. I hope I've shown that everybody is deeply irrational very often. and you cannot assume that people will just listen to official information. That means that we need to be part of the public conversation. And again, we've seen examples of using Instagram and Twitter to do that. We need to understand, as I hope I've shown you today, what to focus on. There are certain messages that will cut through. Research can tell you that. But there are also other things where you can keep communicating and it will never make a difference. Focus on the issues where your communications, and your evidence shows your communications can change people's perceptions, and don't worry about the things that you will never be able to change. And finally, I think, understand those channels that's being used by different audiences, the measures that work, and above all, I think, stick to them. Again, one of the things that's very, very clear in strategic communications, so clear, is that where you have a disciplined, simple message that cuts through, you win. And where you have 10 messages, 20 messages from different actors that are inconsistent, that change day by day, you lose. So simplicity, repetition, and consistency, as always, matter. I wish you all the luck in the world. I wish I was there with you today. Thank you.